closer to 1 will indicate liquid behavior. So we will be able to implant in a more superficial layer, and we will going to have a better dispersion into the plane of injection. Another important rheological property is the cohesivity. The cohesivity is the parameter that describes the force between particles on the same substance to unite them. It's closely related to tissue integration and depends on the technology of cross-linking. Here we can see how a non-cross-linked product will be fully, non-cohesive product, will be fully dispersed, and a high cohesive product will maintain the morphology once we do this cohesivity test. The cohesivity test, we generally do it in an Erlenmeyer with a magnet that is turning, and we put the hyaluronic acid tinted, and then we check at 15, 17, and 90 seconds if it's going to disperse into the water or not. Here we can see a full cohesive gel. Full cohesive gel, that means better tissue integration, and that also will mean less inflammatory response, so less risk to have side effects or delayed effects. We can see that Aliaxin is fully integrated into the tissue with little inflammatory cells compared to monophasic competitors that have a higher plasticity. So we need to select the adequate products. We have in the Aliaxin rheology, we see that all of them, they have a different formulation with a different tan delta and a different rigidity. That is going from the softest one, the G prime of 39, Aliaxin SR, shape and restore, to a G prime of Aliaxin superior volume of 295 that we will consider as our big volumizer. We see on the other side that the tan delta is changing as well. So how higher is the G prime is reducing progressively the tan delta, the flowability of the product, and the plasticity. But that's exactly what we want. We want to have a portfolio of products for different indications and different depths of injection to achieve natural results and to be able to adapt to the specific needs of our patients. Let's go and see now. We are going to continue with Dr. Beatriz Melina and the importance of the customized approaches.
Thank you, Gabriel. That has been very helpful because we have been able to go through the range and understand these specific characteristics of the Aliaxin. These Aliaxin fillers are very unique, and as we can see, is the basic, the fact that every product of the range, even if on paper looks slightly similar, for example, as we could see earlier from FL of a rheology of 45 to say SR, which is a rheology of 39, as we will see later today, the behavior on the tissue is totally different. And this is why it's important that we do assessments with our patients and we decide what products will be more suitable for them, but also where we could place with them. So IPSA first developed what we call MyEvolution. So the first project from MyEvolution was the one indicated mainly for our young patients happens when we want to it's a beautification process, but on enhancement. Of course, it can be used for people that have been restored, and if they have had volume loss, that's been already restored, and they want to also beautify or enhance. But really, my evolution was designed for these younger patients. The rationale was that we saw that all the young people were always using their cameras, and they were taking selfies. They use all these little apps with lights and shadows and touching because they want to enhance certain features. So with my evolution was a total analysis of what we can create to volumize with small amounts in key areas to create these important light and shadow changes, which makes things obviously more attractive or more beautiful. So we could transform those images you could see on your phone to a real 3D without having to use your apps. So some very clever individuals study the shape of the faces, and they decided that then we could probably fit them into 3 specific shapes. So the main facial shapes, of course, are a triangular face, a round face, or a rectangular face. So when we looked at the triangular face, we can see in there the shadowing we have created to where we can inject to create this effect, and the same obviously with the others. But let's go one by one. So this is what we call a triangular face, and we use an M approach. This means if you look at the shadowing on the picture, we're treating the cheekbones, then down into a projection on your angle of the jaw, and then from the middle of the cheekbones and the apex will go all the way down, creating that M shape. Products of choices, of course, are going to be the ones with a higher G prime, because we're talking about young people. There is no volume loss. We're trying to project, to contour, and enhance. So the choice, of course, will be our products with a more than 100 G prime. And as we can see here, there's Aliaxin, SV, EV, and LB. When we go to a more round face, of course, this is probably the hardest, because as we all know, your faces are quite big in general, and you're trying to slim them. So in this case, we're using the Y approach. And as we can see again on the shadows, is going from the mid-face on the cheekbones towards the middle of the face, focusing on these lips and chin, because we don't want to add any more volume on that lower, because we're trying to reshape them all back to that more heart shape or slimmer at the bottom. So that's the way there. And as we can see, the choice of products, of course, is the same. And finally, the rectangular. So in the rectangular, we got people with very long faces, but very narrow. So of course, it makes sense to use the V approach, where we are enhancing from laterally to the middle, following the shadowing like that, to again create a beautification and a more sort of attractive and contouring. So really, my evolution has been a very, very innovative approach, where we can transform a flat or not so maybe angular shaped face to have a really beautiful 3D images, which they look amazing, obviously, without having to take these changes on your app. And it's very simple, because most faces will fit there. So that gives you a very quick, easy approach to understand where we use the products. As Gabriel was mentioning earlier, if you go your SV, which is the maximum projection, that will be for deep bone placement. So it will be obviously your cheekbones or angle of the jaw. When you go to EV, you can go either deep or slightly more superficial, so deep dermis, to again recreate the shaping. And of course, the beautiful LV is the perfect for the lips because of the rheological properties. So you have that adaptability, beautiful and natural results, which is what we want with young people. And the idea of these projects was to use 3 or 4 mils maximum for the whole face approach. When we go now to the next project, we go what we call ego lips. Now, our ego lips, as the name says, is all about the lips. And of course, the 2 stars of this project will be FL which we call it fine lines, but it's also for obviously definition and lip mile enhancement and EV. And we could see here, again, 3 ways to approach it, because we got what we call an essential one, which is for people that never had an enhancement before, and they're a little bit scared to look too different. So they just want a little bit more of a natural, subtle volumization. Of course, they may want just hydration, it's what we call a lip gloss effect. And sometimes a little bit older patients where they want to actually just have a little bit more definition or restore a little bit with their loss, but not being too dramatic. When we get to the global protocol, we are going to be shaping a little bit more and adding a little bit of volume and a little bit of projection and roundness and sexiness, but without being obviously too over the top. We're talking here about using maximum of 1 ml in both of these projects. And when we go to the outstanding protocol, that is more for people that want to go one step further. So you want to either shape and contour and volumize, or you want simply a little bit more volume. So in this case, we're going to play with the 2 products. So let's have a look. This is how we will place the FL product if you're using, for example, a needle. Of course, that doesn't mean you can't use the cannula. But with this effect, you are placing the product superficially on the lip, creating that beautiful glossy effect, stretching the tissue a little bit so it feels hydrated, but it doesn't give you a projection. Remember that the FL has got a very low G prime in comparison to the other products of the range. So we got a G prime of 39. But is that elasticity of the product and the hydro stretch effect, which is what it creates as bounciness and very sexy looking lips. So maximum 1 ml. Then with the global protocols, we're going to move obviously to a little bit bigger G prime because we're talking about more projection, a little bit more volume. You can even give more structure to the lip. And in this case, LV had a G prime of 107. So we're talking just a slightly double, but it's still not too hard or too firm to create lumps or bumps or very stiff look. It still will be very natural result. And again, you can use it with needle or cannula. Maximum you're going to need is the 1 ml. Majority of patients with 0.7 to 0.8 is sufficient. But of course, you do have the whole ml if you wish to go ahead. And as I said, you're going to place it just a little bit deeper than the previous one, because of course the G prime is a little bit bigger. But because again of this hydro lift capacity will look very natural and very, very soft. And with the outstanding protocol, that's what we see, the combination of both. You can use obviously different techniques, but it all depends, because with the outstanding, we can have 2 different looks. The one is just without the opening in the middle, what they call it this O lip. And is you doing this O effect or opening in the middle, you will have to probably use the needle because you want to use those pillars to lift in that direction, as we can see on the diagram. So usually we use the LB first because you got the structure and the projection. And then you can combine FL to give it that glossy effect, that bounciness and softness. And the 2 combined will complement each other extremely well to very sexy looking lips without the risk of looking lumpy and distorted, because the products will give you that beautiful natural result. And finally, we're going to be moving to I Am Perfect. And this is probably my favorite because it's for ladies who are a little bit maybe less young, but we still want to look good, don't we, Editta? So I'm going to leave Dr. Editta Buttura to go ahead with this project.
Thank you, Beatriz. Thank you, everybody. And it's a real pleasure for me to introduce you to the Imperfect protocol. So this kind of new approach to the filler of the Aliaxin portfolio has born from a thought that we made with the company about the women, about patient, about any kind of patient that is coming regularly on a regular basis in our office. So they need to achieve something more. They need something to go further with. And after volumes, after the wow effect that we can give them with volumes, high G prime products, as a maxillofacial, of course, I love high G prime products because they allow me to work on the bony basis to enhance shape, projection, and volume loss of aging processes, but imperfect is something that we can propose to tailor the path of the patient even beyond volumes. So that's the clue. And I share with Beatriz the love for this project because of this, because of its shareability, and because of the possibility to give something more to any kind of patient. So we had the chance to share the vision of IPSA in this project. So we restart from quality and a single product. So the main character of this project are Aliaxin SR and Aliaxin GP, which can lead to a different result, combining the rheology and the anatomy knowledge, so that we can lead patients that are already treated, already volumized, to a better performing face in ears. So we can tailor their imperfection toward a loyalty path that can help us to propose something special and unique in our offices. The two projects are about Aliaxin SR, as I told you, and Aliaxin GP. They have different kind of when we have small relapses or depression after volumizing processes. These are the areas we will focus on. So you can see the upper lateral face and lower lateral face for Aliaxin SR gentilized protocol, and the anterior part of the maxilla for Aliaxin GP, and the nasolabial and marionette line. The technique we are going to use is based on the cannula usage, and the depth of our injection will be the subcutaneous layer. So gentilized protocol is about gentle stretching. We can stretch back the face and the skin of the patient. We decided not to use the lift word to explain this process because it's too surgical. We are emphasizing the capacity of Aliaxin SR to give soft appearance and maintaining the effect of the volumizing processes we had on our patient, or to volumize slightly patients that don't need to enhance diameters. And harmonized protocol is quite different, is again about GP usage, and we can apply it to patients that can be suitable for local enhancement in a nasolabial area, marionette line, and the mid-cheek area. So we go deep in the imperfect protocol with gentilize. So gentilize is performed with SR. The technique is shown on this animation and is about the usage of the cannula in the layer between skin and fat. We use we apply SR that has special rheological characteristic for stretching back, as I said, and to maintain the overall appearance in the initial dermal atrophy patient with maintained volumes. This is the reason why SR is a unique product. So its rheology, as is based on the presence of 3 different molecular weights. It has cross-linked hyaluronic and free hyaluronic. So it is facing the 2 layers we are targeting. So about the dermis, he has the capacity of structuring and hydrating the dermis because of the presence of free hyaluronic, but the cross-link percentage of SR is structuring the missing support of the fat tissue in young patients already treated with volumes, but facing the early aging processes. In the animation, you can see how the fat compartments are getting around an atrophy while we are aging, and we are not able to maintain them with the volumes only. So we need something more. I will show you the assessment. This patient is a pre-treated, almost 50 lady that didn't need volumes to be enhanced. So she has a nice bizygomatic diameter impaired with the bitemporal diameter. So she needs to smooth the gap between the temporal area and the zygomatic area. And furthermore, she has that small descending tissue in the region around the oral commissure. The assessment for SR placement is starting from a triangle that has as a base the lower border of the zygomatic arch, and the anterior margin is going from the zygomatic highest light point toward the temple. The width and of our fan for injection is depending on the anatomy of the patient. So she was not treated with volumes, but she was already volumized like a base for her natural conformation. So we want to fill the discrepancy between the zygomatic arch and lift back the skin. It is possible to apply also the second triangle in the lower face, since we have that sagging skin around the oral commissure. We can draw a second triangle that has as a base the lower border of the mandible, as a posterior base the posterior border of the mandibular ramus, and the diagonal point between the border of the mandible and the hairline insertion and the tragus is useful to inject anteriorly and to push back and to stretch back the skin. We suggest the usage of a cannula with 50 millimeters length and 25 G of diameter caliber. The technique is a fanning technique, and the crucial point of the technique is to apply a dissection, to perform a dissection, a subcision of the triangle between the skin and the fat, where we want the SR to flow. We have to remember that the rheology of SR has a very high tan delta. In the range of the Aliaxin product, SR has the highest tan delta, so that means that it's behaving like a fluid in the skin, and it will spread spontaneously in the triangle we are dissecting between skin and fat without flowing any other way, because of its high cohesivity. That is the second really important characteristic of this product. I think that undermining is necessary to increase the efficacy of this filler, because of its high cohesivity and its high tan delta will perfectly fit with the pouch you are drawing, you are cutting like in surgery. The same is performing in the lower triangle. Here are the two videos of the technique. As I explained you, these are the holes we have to perform with the needle, the 23 needle, that is allowing us to enter with the cannula. In the upper face, in the upper video, you see that I am submining, I am subsiding this between the skin and the fat. I'm going up to feel, to be sure that the filler is filling the gap between the temporal area and the zygomatic arch that is already volumized. And when I'm injecting toward the ear line, I'm going beyond the hair insertion line because I want to stretch back the skin. In the lower face, you see that the cannula is really superficial because it's only subcutaneous. We have no vascular issues in this layer. So I move the tip of the cannula toward the tragus to lift up and back, to stretch up and back the skin excess that we saw around the oral commissure. The amount we perform is 2 ml, one in the upper triangle, one in the lower triangle. Here you can see the results immediately after the procedure of 4 ml injection of SR with the technique you saw. You can see that the patient has a nice stretch back of the skin. This is the side view. You can see the small holes of my cannula that are already visible, and the result is very nice. This is a spot of Beatriz, and she applied her protocol, and the picture is taken 3 months after SR protocol. I wish she can inject me really soon. This is a patient of Beatriz as well, with this nice result and a nice skin appearance. Remember that we are playing with a filler that has a double meaning with cross-linked hyaluronic and free hyaluronic in co-presence in the vial. This is again another patient underwent an Aliaxin gentilized protocol, and we are injecting a patient already volumized. I will show you hair path. That technique is right the same of the one you saw before, but the animation you see on your right is really good to understand how the cannula is running, sliding in between the retinacula cutis ligaments. You will feel, you will perceive the resistance of the retinacula cutis that will make you know that you are in the right layer. So I think something is not running, but I will move further to the next slide. Okay. Okay. Yes, got it. Thank you very much. So this is the path of this patient that you saw. She came to my office for a rejuvenation in 2019. Then she moved after the volumizing protocols. So she had volumes enhancement, and I injected her with a conventional high G prime filler on the periosteum in different areas of the face, but the maintenance was performed after 2022 with SR protocol only. And this is the picture taken 10 months after the maintenance with SR protocol. This is another patient that came to my attention for rebalancing the face. She has a hypoplastic upper maxilla and a hyperplastic mandible, so her early aging lines are the nasolabial 4 and the tear trough deformity and the ibex because of the lack of support of the soft tissue by the hypoplastic upper maxilla. I volumized her with a conventional technique with a deep injection, and I treated lips again, lips also. And this is the maintenance with SR protocol and lip enhancement, of course, with an outstanding protocol of Ego lips and Aliaxin as well on the lips. And you can see how the result is good. And here was combined the gentilized protocol as well. You will see with Beatriz, but this is a full imperfect protocol. So gentilize and harmonize. This is the side view. So just to go a little bit deeper with the imperfect protocol, she applied the SR on the upper cheek only because the mandible was already really important and designed. And I applied also GP in the upper mid face to support the orbital region without injecting the tear trough. This is a patient that came to me for a volumization, and she got this result after volumes and toxin injection. But here she was with a health issue. She underwent ankle surgery. So she lost 15 kilos and she went to this nice result. You can see she's not healed completely. She didn't recover completely, but I treated her after 15 kilos lost and after volumization with the SR protocol in perfect. This is the side view where you can see that the fat depletion of the neck is really visible, but the volumes are well maintained by the injection of the 4 mL of SR in the upper face and the lower face bilaterally. This is the animation picture taken after volumes and after SR. You can see that all the range of Aliaxin SR is really, really natural in results and also in mimic. This is again a patient after volumes and after imperfect protocol with SR, so gentilized protocol. This is the side view of the same patient, baseline, after volumes, and after imperfect. So I think that is a really nice tool to apply to your patients to increase their loyalty and to make them know that you have something more than volumes. They are scared about changing, about being overtreated. And with this protocol, we can assure them nice result, classy result, natural faces. I think that next case, that's my last case, is the paradigm of our study, our mission with this communication. This is a 48 years girl, never treated before, with elastosis, thick skin, heavy skin, and she wanted a rejuvenation of the lower face. But it is not a really easy face to treat because of many facts that I explained. This is the result after my evolution. After the treatment, she had a big improvement, but 1 year after, 10 months for precision after, we wanted to give her something more. And she was one of the first patients purely treated with Aliaxin products that underwent with imperfect protocol with this kind of path. This is the result after a session, 10 months after volumization. This is the maintenance, and the picture was taken after SR protocol with 4 vials of SR, 1 ml per area, upper face and lower face. And of course, we went back again on the lip area and the oral commissure. You can see that she could look like an overinflated, overtreated patient because of the dynamic of the face and because of the bulk of the muscles and the skin in the upper face. After volumes, nevertheless, I treated her with different vials. She didn't lose her naturality, but after imperfect protocol, I think she earned even something more. You can see in animation how natural the dynamic is, how nice the result is, even, and the gap she had from the baseline to the point after volumes is even more exciting after SR. So the gap after volumes and after imperfect protocol, it is even something more. This is the dynamic result and the dynamic after imperfect. That, to me, is giving something more to our patient, and they will be more happy to be loyal to our project if we can give them something more sustainable and something that can lead them to be the best version of themselves. Here to you, Beatriz. I hope I was not too long, and for the gentilized protocol, I have told you everything. Now, Beatriz will introduce you the harmonized protocol based on GP.
Thank you so much, Editta. Beautiful results. And this is why we both love so much this project, because as we can see with Aliaxin SR, we can create that beautiful stretching, which will give you a very natural result. But sometimes our patients need a little bit of an enhancement, as either the beginning of the facial aging where they're losing a little bit of volume, or they just want to enhance only a little bit because they're scared and they don't want to change. So for these, we're going to change totally to our Aliaxin GP, which has got that optimal lifting capacity of 95, so it's just under the 100. But with that hydrolift effect, it's allowing us to use it on those very mobile areas to give that little bit of enhancement, but staying extremely natural. And the way we're going to do this one is obviously in cannula again. And the reason we choose cannula for these things is because we want to spread the product, maximizing how they spread, but putting very small amounts. So as we can see on the diagram, we're going to place it subdermally. And the idea is to track those fat pads where you lose a little bit of volume and you want to three-dimensionally enhance it. So these are the most typical areas we can treat. So the mid face, so you part of the mid part of the cheek, of course, nasolabial, feathering into maybe the upper lip area, and of course, those marionettes. And if you wanted a very simple approach, we can have those 2 injection points, but I will show you later, obviously, another couple of options for entry points for people that prefer it. So firstly, you want to be for that lower part of the face, which is very hard to treat. It's about 0.5 centimeter to 1 centimeter outside the corner of the mouth, because that allows you from one entry point to treat those nasolabials, the corner of the mouth, and that top part of the marionette, where that beginning of volume is fading, and sometimes even a little bit of that little sumala part where you may find, particularly in runners, when they lose it, it creates a little bit of a bulge on the corners of the mouth. And of course, for the mid face, you can follow about 1.5 centimeters laterally from the zygomatic, or you can actually, what we call it in terms of the tear trough, follow with your finger down into that mid face. And when you can push and you can get that elevation and lifting, that's a very good place to enhance that fat pad. So we can see here, for example, the typical approach for a nasolabial fold. Of course, this is very simple for you guys because you're all very experienced, so it's not much to it. But the idea is to think of these rheological properties, because we're not here, we don't have a very super deep line. It's just the beginning of the volume loss. And I do like to feather it a little bit into that upper lip area. And you can see here she's got a little bit of a weakness above that lip area. And because this product is so versatile, I call it myself a 4x4, so you remember it, because it can go really pretty much everywhere. And these dynamic areas do need a product with this stretching capability and resistance to deformation, because you want to create a bit of lifting, but not to be very stiff. So that will be a very good place, as we said, for the nasolabial fold. And then we'll move on because we can go through all the different areas in a minute. But this is just to give you an idea of the results you can achieve with small amounts of product. In this case, 2 mils of product, one in the mid and one of the lower face. When we go here to this other patient, she's had previous treatments and not for a little while, and she cannot really afford the maintenance to have a lot of work done. So she has used a little bit of Profile as well in the past, which is a great product to combine because obviously you work in an elasticity and tightening of the skin and you obviously preparing everything, but you needed a little bit of a soft enhancement. And in this case, we're using the other point we see on the diagram where we can treat that mid cheek, and we're using a 25G cannula. I tend to up here use the shorter cannula, the 38 millimeters long, just because I got a little bit more control. And the idea when we're talking about this part of the middle part of the cheek is we need to be a little bit deeper. So this is the only exception. So we have to definitely go underneath of the fat pad because what we want is the product to move very well in the area because we know it's very dynamic. It's a lot of forces and the muscles interactions. So we don't create that sausage effect. So the idea is to place the product, as we can see, on that mid face. When we see on the other video on the on our right hand side, when we're looking at the screen, you can actually also go from the if you do like a line between the corner of the eye and the ear triggers, and you go sort of to the third part of the triangle, we can actually insert this product at that point in there and create that we can see with the cannula we're doing at the moment, a little vectoring to overlap the fat pad more laterally. So for people that don't want to turn it in the other directions. Now, obviously, beware of the hairline because obviously the hair could be a little bit of a problem with the cannula for touching it. And you could, of course, place it superperiosteum for someone with extremely thin skin, but you can go, you see, to dermally because it's a beautiful soft product and it will glide very well to create that natural soft enhancement without changing too much or the look of the face. So it's just about lifting without causing a major change. And we can see improves even under the eye area, even if we haven't even treated in there specifically by stretching laterally. And that's on the lateral profile. Again, we can see the luminosity, the lights are reflected so much nicer, but she doesn't look overly different. We haven't created the typical volumization of the mid face. In here, I was drawing the triangle the way I will do it. I was trying to explain earlier to choose those key points for access. And as we can see on the top third of the triangle is where your zygoma will fall. And obviously the apex of the zygoma will be on that midpoint I'm marking right now with my pencil. And of course, you could do boluses. Of course, you can for this technique. That final point is the entry point I used on the previous video. Now, we can see on the other video on our right-hand side is another entry point if you want to treat the whole of the marionettes, which in this case was needed. Because in the previous one, we were only using that top part and the corner of the mouth. But here we wanted to really use it for all. And as you can see, she hasn't got very deep volume loss. So in that case, this is why GP is perfect. Of course, if the volume depletion was bigger, then we will use a slightly bigger G prime for it. But this allows for people that are for first time, like this lady never had any treatment before apart from toxin, and she was very scared to be too different. And as we can see here, straight after treatment, this is just 3 mils. So 1 mil per side on the mid face and 0.5 per side on the marionette. So you get a very natural enhancement, a refreshment, but she still look herself. On the 3/4, again, beautiful lifting, beautiful changing on the light and the reflection, but it's still natural. And I wanted to put a video because it's always nice to see actually in real life. This was when half side was treated and the other half not treated. And as we can see on the other side is when we finished the treatment. And it always looks better on a video than a photo because you get the real 3D. You get actually to see how we have on the points and with marking with the pen, go into these areas and enhance with just 3 mils. Beautiful result. Natural and very fresh. Sometimes we got younger patients that want to treat their mid-face, and again, they don't want to be totally enhanced like we have been seeing with Mevolution. So in this case, it's very good for this periocular area. And of course, you can use that middle point we can see on the diagram in there, because you can go forwards and forwards. So it's very similar to what we've seen earlier on the anatomical positioning. But we can see on the video, in this case, I'm using just the one entry point. So we treat first that middle part, again, deep. And the thing here is about changing plane. So you're going to go firstly deep on the mid area, using my finger on the orbital rim, so we do not go above the orbital rim and protect it, because that's not the aim of this technique. It's simply treat that mid-face enhancement. It's extremely popular with young patients, you know, early 30s even, because sometimes we don't have a lot of fat naturally in that area. And as we saw, this midline, it makes you look very tired even when you are very late 20s or early 30s. So 0.3 max, so 0.2 to 0.3, depending on the amount you want. It will look even better after several weeks, but you do have a perfect correction. So you don't have to over volumize. You can actually, on your optically, where it looks beautiful, leave it like that. You don't have to put less or more worrying about swelling either, because the product will maintain very well with no downtime. As you can see here from my entry point, I am changing the angle. So I'm doing really like a fanning technique. Again, staying very deep and positioning first the cannula to be sure the patient is absolutely comfortable, going back again to the entry point, and then turning again to the third point of funneling. Here we're able to get nearly to that outside of the outer canthus, but below the orbital rim. And I can keep it again a little bit deep if the skin is very, very thin. So there is no visualization at all of the product, because as we said, the G prime is not very big. So we are making sure she's comfortable, and then only then I'm repositioning my hand and injecting linear retrograde. And I use about 0.1 to 0.2 maximum per linear retrograde. The idea is, if you're only doing a small amount on the mid-face, you could actually get away with 0.5 per side of the face. If they need a little bit more enhancement, then you will use 1 mil per size. As you can see here, we're going now to the parts of the lateral cheekbone, a slightly, as I said, different approach. The patient is extremely comfortable. I'm just placing the rest of the filler. So maximum, as I said, 1 mil. So this is just immediately after treatment. And as you can see, there is a beautiful reflection of the light on that zygoma, even if we only use 0.2 in there. But what is done is blend the transition between the mid-face and to the orbit, so it looks more fresh and she looks less tired. And interesting enough, there is a slight improvement on the nasolabial and corners, that little bulge along the corner of the mouth, because of that slight elevation or tightening of the tissue. Again, on the other side. And I wanted to show this case because this lady had never had fillers before, and she was concerned about her eye area. So this is a slightly off license, because obviously we're going now into the orbital ring with GP. The technique can be a little bit different, but I want you to see the longevity. So this was in June 21 prior to a treatment. Then she came back in July 22 for just botulinum and toxin, no more filler. And when I saw the photos is when I went, oh my gosh, that was you a year ago. And look at that. So a year later, actually over a year later, she still have a really beautiful result with GP. And she came this year in January 23 because she thought, oh, I think I may need a top up. And this is before treatment. So from June 21 to January 23, we can see that it's still an improvement, and the longevity of the product is really good in this area. So just to recap, we have seen today with Dr. Buttura the IMPERFECT part of the Gentilized protocol for soft contouring, skin sort of tightening in a way, because we're just elevating that tissue, improving the quality because of this beautiful characteristics of Aliaxin SR with a 3 molecular size, which allow us to not only give you the normal effect of a filler, but of course, is also that 500 kilodaltons on the product, which can hydrate a little bit the skin, and even we have proven now a little bit of collagen production in relation to this, which is why we get this firmness of the skin, improvement of elasticity and skin tone. And of course, the fantastic 4x4 are Aliaxin GP, which we can use pretty much everywhere of the face when you want that naturally soft enhancement. You want some support and a little bit of elevation or lifting of the tissue. And of course, it's usable from any part of the lower face, as we can see. So I think now I'm going to leave you back to Dr. Siquier, who will go through some of the questions with you guys. So thank you very much.
Well, thank you very much, Dr. Molina and Dr. Editta Buttura, for this wonderful presentation. I think was very clarifying, but we do have some questions from our doctors, and let's gonna start with the first one that is coming from Dr. Luz Maria Flores from Paraguay, that is asking me, how often do you do it again? So when we need to repeat this protocol, what is your point of view?
So if I can answer for the Gentilized protocol, I think that the time it's suitable to be repeated is after 10 months. It is not avoiding volumes, of course, but it's maintaining. So when you, let's say, volumize today the patient, in 10 months, you can apply IMPERFECT protocol. Then you will check the patient, I think, at least 6 months after, to assess if there is something to do more. And seldom I find that I need to support more often the anterior maxilla if there is a lack of bony support. And sometimes, instead of volumes on the periosteum, I apply the harmonized protocol then. So I think once a year or something less.
And I think we can also adapt depending a little bit from the patient needs and wishes. And what about you, Dr. Molina? What do you think about the with the other protocol? You will.
So I agree with Editta. When we get to the 10 to 12 months, most people will need a small top-up. However, I have to add on, if you patients are using Profilo as a maintenance in the middle, you may find that the longevity is even better because it's a very good complementation between the two. So you don't need very large amounts unless you have great amounts of volume loss or a peak of aging, where obviously you may, but otherwise it's quite good. And I find that you need, rather than the 4 mils, I will only need maybe 1 or 2 because you are maintaining rather than doing it from zero.
Yeah, very much. And now taking you from that, I'm gonna ask about the combination with Profilo. Now we also have a question in the audience, how we will combine it. You will combine it in the same session because we are working on different planes, or you will combine it in different sessions?
I prefer to separate it. I prefer, if the patient is not in a rush, I will start with Profilo because I think you get that improvement on the skin quality. And as we see, Profilo also work in the fat pads. So you get an improvement of the adipocytes. So that means you're going to need less work afterwards. Once I've done the 2 sessions of profile, I bring them a month later, and then we visualize the face and decide, obviously, what protocol is more suitable or what products are more suitable, because it depends if what you want to achieve. If you are using only SV or some products which you go super periosteum, of course, on the first session, I may do a little bit of positioning of products super periosteum with Profilo. That's no problem. But if I'm working with Aliaxin SR, I feel that there is a little bit of a competition because they're both in a very similar plane and they're both trying to achieve that stretching and elevation in a way. So I prefer to separate it. I hope that sort of answers the question. It's quite complex because depending on the products and the patient, but in general.
Yes, I do agree with Beatriz. So once we are talking about the light products, low G prime products, as we are doing with GP and SR, it's fundamental to split the session to me, because they are working in cooperation. So once you see the results with the Profilo, then you can decide where and what to apply and how to combine the 2 protocols of imperfect, so gentilized or harmonized. So you have to set the patient to assess again after Profilo. That is, of course, the base of our work.
Yeah, thank you very much, Editta. And now talking about security. Is risk of vascular obstruction in the temporal region, because we are working there. I know we are working with a cannula, but we need to be aware of or some tips that you can give us to be more safe.
Of course. So we are working in the subcutaneous area. So the risk to have a vascular injury is low, and we as well use the cannula. Normally when I slide the cannula in that area, I'm really slow, and I am really gentle in injecting. So the layer we're considering is between skin and fat. So you dissect that not vascularized layer. So the anatomy studies and the dissection is showing that the layer we are injecting SR is quite sure. But of course, you have to be skilled in anatomy and know where you are going. And of course, if you need to drive the tip of the cannula close to the temporal artery, you have to put your finger to cover it and to protect it. But it's not necessary to go that far. And we have to consider as well the anatomy changing and variations that we can have in patients. And I think that anatomy knowledge is fundamental, but you will be really safe with these indications.
I totally agree with you, and the use of the cannula makes it very safe. Always remember to use a cannula 25 or a little bit bigger, and to be sure that you are on the correct plane. But let's gonna make now another question that is from Dr. Chantal van der Pas from the Netherlands. And can we apply this protocol also in men? Is the same in men and women? Beatriz, what do you think?
Less frequent, in my case, to use this protocol in men, because usually we want to make them very masculine and very angular rather than very soft. So I tend to use more the bigger G prime products on a male, and then I try to obviously sharpen. However, of course, some men will need temporal area treated or forehead treated or other areas with Aliaxin SR. It's no reason not to use the product itself. It's just the technique, particularly with the Gentilize, is, I think, more for a lady. When it comes to the Aliaxin GP, however, it's very different because I use it a lot in male for the eye area and that mid face because it's very soft, and men don't want to have the bigger volumization on that mid face or eye area and nasolabial folds and things like that. So it's okay for me more in GP, but I think Gentilize, with a specific Gentilize approach we have presented, I don't tend to use it, no. What about you, Editta? Do you?
So I totally agree with you. So it's a really seldom happened to me to apply the full gentilized protocol to men, and maybe they have different features. So the anatomy is predisposing a gentilized approach, but they don't need to be square, and often men are really more horizontal and wide than women. And I think that gentilize is something that enhancing the heart shape of the face and the back lift of the skin. And more often I apply the harmonized protocol to men because of their application in the anterior malar area and nasolabial fold. That is the main area we are normally planning the imperfect for men.
Yeah, and with older patients, can we also do this protocol? Because we see that we can do it after, for example, myevolution to maintain the results, but how we will target a patient that already has a little bit bone resorption and some changes because of the advanced age?
So I would like to know also the opinion of Beatriz, but I think that once you volumize the patient and you don't have any space available to inject volume and do projection and increase diameters, then you can have enhancement with SR in any age, at any age. And I often use it also in two special area of patients. So already over-treated patient that I slowly melt. So I do high lays on patients, and then maybe they don't accept the transition from big volumes to the normal volumes that I will propose them. So SR is something that in this transition can help, and also in patient treated with fibrosis, with the scarring, deep scarring. It is a special issue as well, but SR to me has had an application all over the face to enhance this small layer of contouring.
Yeah, we have a lot of questions, so we have to be a little bit shorter with the answers. So we have another question about safety. It's about the malar zone. How deep you go with the cannula, and it's safe to inject because it's dangerous zone about the facial vein and the infraorbital, from Dr. Dani Arroyave from Colombia.
So very quickly, you are far from the infraorbital area. You are starting subcutaneously from the highest light point in the cheekbone backward in the subcutaneous tissue. So you are really safe.
Do you want it quick, Gabriel? That was quick.
Yes.
So the rheology of SR is allowing you not to massage. You will see injecting. I'm teasing you to do it. You will see that if you do a proper subcision, if you create the pouch properly for the product to flow, it will flow spontaneously. But you can, of course, massage if you see something that is uneven, maybe some small amounts of product that are on one side. You can massage. And I always double check with my finger with a very gentle massage that everything is even and smooth. But if you can, if you want to displace some product, you can do it with a harder massage. Yes, it is. And compression on the side of injection if you see bleeding after retracting your cannula, for sure. Ice and normal indication after treatment.
Yes, very good tips that will help us also to give a better comfort to our patient and to make them feel more comfortable. I have a lot of repeated questions, so we're not going to go over them, but definitely you can see again the webinar on IMCAS Academy if you want to refresh again the techniques or the protocols. This is one question that we got here. And there is one question, I cannot find it now, is what makes unique for our patients to use these products?
You see, I think with these specific products, we're going to achieve natural enhancement. We're talking about people are going to go, oh my God, you look amazing. You look so well. But no one is going to go, oh my God, what have you done to your lips? Or what have you done to your cheeks? Or, no one is going to think you've been treated. They make us suspicious if they know your date of birth, but you're going to look well without, but it's natural. But it's effective. It works very well, and you don't need a lot of product. We're not talking about 10 to 14 mils to get these. And we saw from the images today, you get fantastic results with very small amount.
Yes, definitely. And the rheology of the product, the integration into the tissue. We're not going to have implant palpability. We're not going to have implant visibility. It's easy to do protocol with low amount of products. So with 2 to 4 milliliters, we can do full face and rejuvenation. So I think it's very, very good to use this Aliaxin SR and Aliaxin GP, but we also can combine it with Myvolution protocol or with Egolips protocol. We have 3 fantastic protocols to follow and to target different things. I think we have a lot of more questions, but they are a little bit repetitive. So if you have any other one, we can answer a little bit later, but we answer all of them or all the team. Thank you very much for assisting to this webinar. It was a pleasure for me, and to be together with these great speakers like Dr. Beatriz Melina and Dr. Editta. And I wish you a very nice rest of the day, and hope to see you soon here at IMCAS Academy. Thank you very much.
Well, thank you.
Thank you. Bye. Have a nice day.